Right. Today also we are going to discuss about the same topic, middle cerebral artery. We divide the 10 a stroke patient. How this 10 stroke patient recover. Recover with this categorized method. First patient, second patient, third patient, likewise 10 patient. First patient 1-2 week, second patient 3-4 week, fourth patient, third patient. We can give this some form of duration to prognosis, come to the prognosis and recovery normal level in this categorized method. Last day also we discussed the second patient. First patient end it. The second patient discussed the last program. Today also we discuss the second patient. Second patient is the head injury. There are some form of damage inside the brain. The dominant side, left side of the brain, contralaterally paralyzed hand and leg. This patient also the first 3-4-5 days bedbound. Sometimes cerebral edema also they can happen. But after 2 week, 3 week, he is gradually improved, quickly improved. Hand function 0, 1, 2, 3 gaining gradually, quickly gain. Leg also the quickly gain 3, grade 3 level. Then strengthening apply this patient to correct hand and leg. Today also the some form of thing we add this 2-level patient. A lot of speech problem, reduction of this patient, speech situation. But this patient continuous urine and feces, the urine, he can balance the motion and urine balance. He can. That's another important thing. After 1 month, this patient total recover. Some form of sensory issue can be there, this hand or leg, but cognitive function also the some form of little bit gain normal level. Emotional problem, most important to discuss emotional problem. This patient is a breadwinner or master patient. A lot of work in the home and the situation of the workplace or school study, a lot of he can do. He is the master person, but this damage he can't do a lot of things. Totally emotional problem can happen. This patient. This is the another point we have to discuss. This paralyzed situation, correct? And facial expression and facial and visual problem. A lot of covering and speech aphasia problem. We have to gain a lot of motor and sensory gain to the 1 month normal level. That's the most important point. Continue treatment, intensive treatment to this patient. 1 month is totally cured. The second patient is speech, also the lot of problem point. It is also the gradually 1 month correct. Another thing we have to discuss, swallowing, and speech and neglect area. Those are the approach of the speech therapist, approach of the occupational therapist, approach of the physiotherapist. The teamwork gaining to give the intensive therapy. He is quickly gained. Second patient, 1 month, totally cured. Right, we discussed the second patient. Today, going to discuss about third patient. Third patient, cure the. This is the third patient. Some form of difficulty of the hand movement, finger movement. Leg also good. Third patient. Third patient cure after 1/2 month. Total cure. Emotional cognitive function. Emotional cognitive function, some form of not to properly correct, but some little bit changes can happen to the brain. After 1 month, he can do the own ADL activity, and he can do the workplace, the job service, and they are functional. The play, leisure activity, all he can do the after 1/2 month. This patient also the having dominant side, brain damage, and contralaterally paralyzed hand and leg. Paralyzed hand and leg. Paralyzes hand and leg. But leg gradually come to the 0, 1, 2, 3 level. Grade 3 level. Gradually improve grade 3 level. Hand not to come normal level, some form of reduction happening to some form of the deformity, some form of muscle gaining problem happening to the third patient. Hand problem. There are some hand problem to this patient. Speech problem also, this patient having some form of small aphasia problem. Speech and swallowing problem. After 1/2 month, he can walk. This patient also the previous 7 days, likewise he is also the big bound. Totally paralyzes contralateral side, hand and leg. Brain also sometime edema, likewise the speech totally gone, and the swallowing problem also having this patient. The visual problem also there in some form of eye movement also can happen. The numbness of the face or hand or leg, the some small point, they have the more pain, aggressive pain and severe pain and burning pain. Likewise some joint pain also this patient have. The after 2 3 week, after 2 3 week, is muscle of the leg of the hand grade 0 to 1 2 3 level come to gaining. After 1 month, 1/2 month, totally correct the leg, he can walk, he can ambulate, but hand movement also can't do. Sometimes apraxia, sometimes finger movement reduction, the opposition finer movement not gain. After 1 month, finer movement not gain. Sometimes neglect area, a lot of neglect this right side area. He can't write. After 1 month, he gain into the writing little bit gaining the writing problem also this patient. After 1 month, the gain in finger and writing ability. After 1/2 month, he is totally cured. The before 1 month is the urine control, not incontinent, the urine and the can't to balance. The after 1 month, he can balance and the catheter remove. The swallowing also the problem. The NG tube can apply. The after 1 month, this is also totally cured. After 1/2 month, he is normal level. Third patient come to me after 1/2 month. Paralysis area totally cured. And visual stimulation most important. The neglect side stimulation lot of important when doing the activity. A lot of me neglect area, reach in the neglect area, and lot of talking to the area. The ADL apply to this neglect area. He is gaining intensively give this treatment. Lot of gaining 1/2. The range of movement 1 month is not to the full range. After 1 month is actively can move to the hand, the front side up and down likewise area. Extensor mobility, the flexors mobility, hand of the flexors mobility, a lot of time the flexors mobility come quickly, but the pattern of the hand can't break. We must apply to the extensor side lot of intensive, then the extensor lot of gaining and he can extend muscle work. That's the most important point to the apply extensor pattern of the arm. The trunk rotation most important. Trunk rotation, lot of neglect the right side, rotate lot of time to the and lot of time rotate this side and stimulate this area. Hip also the most important. We discuss hip mobility. Also the most initial stage we have to gain the hip mobility. It is also the lot of important to ambulation. Yeah, right. Third patient, the difficult to area finer movement is speech, swallowing and walking. Neglect area stimulation is the most writing is the most dangerous and difficult area. Third patient cure after 1/2 month. A lot of work together, multidisciplinary work, doctors and other caregivers and physiotherapy, occupational therapy, speech therapy, a lot of teaming working to the after 1.5 month, we can totally cure the third patient. Right? ADL, when we bimanually activated to a lot of activity, it is also that we have to concern that patient is the male or female. The female also lot of they are like to the kitchen activity, preparing meals, preparing and tea preparing, lot of activity we have to gain. That is the assessment point. A lot of important the assessment. The, when we start the therapy, we apply a lot of assessment to the several area. Cognitive, paralysis, sensory, motor. Sometime we can apply to the extensor muscle, what are the work, the flexors muscle, what are the work, antagonist, agonist muscles. Then another is more important thing to reflex, the reflex of the muscle, the tone of the muscle. That is also the most important. How to gain the tone, what is the tone, the 0, how to gain 3, 4, 5. Is gradually we apply to the tone. When the near the 1 month, we have to mobilize passively. Lot of important passively mobilize, because when we are doing the passive mobilizing, all muscle, agonist muscle, antagonist muscle, we have to think the agonist come quickly, and same way, the same time we have to try to gain the antagonic muscle. This is the balance of the muscle is the most important of this patient. This is the most important. Another thing we have to discuss. First patient cure 2 weeks, second patient cure 1 month, third patient cure 1.5 month. He is also middle cerebral arterial damage. A lot of problem are occurring to inside the brain system and circulation system, and sometimes it is can be a circulation blocker, perfusion blocker, ischemic stroke, infarction. That is the it is sometimes difficult to correct. It's take to the lot of time. The 1.5 month is the most suitable point to we have to discuss about the third patient. Right, the range of movement also the normal, the trunk mobility also the normal, hip mobility also the normal, and visual, speech, and swallowing, those are the normal after 1.5 month. Right, that's conclude the third patient. The emotional problem is the another one, emotional situation. The before the GCS level also the most important. GCS level, the before, what are the GCS level? The gradually he gain in the GCS level 1 month. 1 month is GCS level 15, 90, 10, 9, 9, 10 likewise gaining. Then suddenly go we can the 50. Right, and the mental state examination also the lot of important to it is also the discuss the assessment situation, the bow bath technique, Barthel index. So a lot of we can apply to this patient to the method of the assessment method. But this the eye assessment is the most important, eyeball assessment. The in Sri Lanka not using the lot of assessment. All are in the mind, all are in the brain of the occupational therapist mind and speech therapist mind, or and physiotherapist mind. Their experience is the lot of marvelous to gain this patient prognosis correct and cure quickly. Okay, third patient. Today also the some form of thing we are discuss this third patient. Uh, right circulation system of the brain is the most important. We have to knowledge about this middle cerebral arterial circulation system. It is most important to the identify CT of the brain, MRI of the brain, and those are